Our College of Nursing is one of the largest colleges of nursing in the state of Tennessee, and we produce a large portion of the nursing workforce in this area.
When professionals seek to be trained, they have access to funds from loan sources, and that allows them to complete their training. And the total amount that professionals can actually access is a total of about $200,000 over their training period. So it gives them adequate resources to be able to fund their training. When you apply the label of non-professional, the amount goes down by about half in terms of the accessibility of funds. It especially affects those that are seeking graduate education because they cannot get access to the same amount of funds as a pharmacy student would, or a medical student would, or other health professionals as designated by the federal government.
The new guidelines for these federal loan limits don't specifically say that nursing is a non-profession, but the implications from using that language are quite clear to the nursing profession, which has for decades struggled to be recognized as a profession. It's worked very hard in that arena. So my fear is that by using that language and limiting the borrowing power of nurses who want to become advanced practice registered nurses, that's going to impact our ability to recruit nurses into those very impactful roles in this area. And I don't think that people understand that advanced practice registered nurses, especially our nurse practitioners, actually provide about 55% of primary care in the state of Tennessee, over 60% in rural areas of the state.
It's important to understand that all of the people that participate in the healthcare team do so in a professional capacity and for their career and for their profession. And so to label any member of that team as a lesser contributor really harms the entire team.
I think there's still this very old viewpoint by many policymakers that nurses are the angels in white. And they are, they are. But nurses are more than that. They are integral members of the healthcare team. They are providing many times the frontline care, especially in primary care. So I think the policymakers have to really look at the workforce and what's being done and not just trying to look at the various criteria that you can put on the labels that are associated with a degree.
Our college represents about 14 distinct healthcare disciplines. And if you look collectively at all of those healthcare disciplines, that represents roughly 50% of all of healthcare workforce. So if you look at the overall impact for this state in the region, it's quite significant, given that healthcare represents roughly 18 to 20% of gross domestic product in this country anyway.
The professional workforce is vital to our communities in Tennessee, especially our rural communities, and being able to know that our professional workforce can receive the funding and the degree programs that they're looking for so that they can turn around and help care for our communities is integral to Tennessee's health and well-being.
This is not non-professional work. This is life-saving work.
Stand with us in honoring healthcare professionals, the backbone of Tennessee.
Together,
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 Together, we are ETSU Health.